Okay, this is Amelia Hill. I'm here to do my medication and oral medication and sub-Q check off. My supplies that I have is I have a laptop here that is not on. It's not on. I have my MAR that has my orders. I have hand sanitizer, I have Dilantin, a pill cutter, a cup for water. I have my meds here, I have an insulin syringe, and a card to use as my alcohol pad, and a hair bow for my cotton ball, and a pair of gloves. The first thing I'm going to do is I'm going to verify my order with what is in the MAR. So I would take my order and I would verify my order with my MAR. And this is going to be for Pat Chamberlain. I'm also going to be verifying this that I have the correct patient with what is in the MAR. So for Pat Chamberlain, date of birth is 1/1/1961. Dr. Shapiro. This is going to be for Coumadin. It's going to be for Coumadin 2.5 PO once a day, daily. Lantus 26 units sub-Q daily. And Dilantin 375 milligrams suspension 2 times a day. The Coumadin that I have is a 5 milligram tablet. And the Dilantin it comes in a 125 milligram per 5 ml suspension. So now that I've verified my order on the MAR and I've verified that there's no discrepancies, next I'm going to verify the allergies. If the patient has an allergy to betadine, patient doesn't have any contraindications to why they can't take this medicine. Put this up, don't need that anymore. Patient sitting up here. Okay. So now I've confirmed that I do have the right patient and there's no discrepancies in the system. I'm going to do my first check. I'm going to verify that I have Coumadin. First, I'm have the right patient, the right drugs, the right dose, the right time, the right route, which is going to be oral for the Dilantin and the Coumadin, and sub-Q for the Lantus, which is route, and then I will have right documentation at the end. I'm going to next do my calculations. So for the Dilantin, with it being 125 in a 5 ml suspension, the patient would get 15 mLs, and I would put this at eye level, and I would pour 15 mLs into my medicine cup. My Coumadin comes in a 5 milligram tablet. I'm going to check the expiration date. I'm going to take this Coumadin and cut it in half. I use that. And then for my Lantus, I'm going to draw it up to 26 units. I'm going to pull my Lantus from the Pyxis. I will take this cap off and clean it with alcohol. I've pulled back 26 units of air. I would insert the needle, invert it, push the air in, and then I would pull back, pulling out 26 units of Lantus. Done with that. And then, I would do my one-handed scoop to recap my needle. And I'm going to have I've checked my calculations, and I'll have another nurse to verify my calculations, and I would be doing my second check for right drug, dose, route, and time. Okay. So next, I'm going to the patient's room. I am going to go in the room. I'm going to provide privacy, and I'm going to perform hand hygiene. I'm going to get 2 patient identifiers. The patient's going to give me his name and his date of birth. I'm going to verify his allergies and if he has any issues swallowing. Next, I'm going to give him the rationale to why he's getting all these drugs, the drugs that he's got, the doctor has ordered for him. I will answer any questions. I will let him know about any adverse reactions to look for. And then I will get verbal consent from the patient. I would do any vital signs or blood sugar checks that I needed to do before I gave him any insulin or give him the Coumadin. So I would check his blood sugar to make sure, or verify what his blood sugar was in the system before I gave him any of his medications. I am going to do my 3rd check, which I have the right drug. I have the right patient. I have the right drugs. I have the right dosing. Looking at my MAR, 2.5, 26 units. I have 15 mLs of the Dilantin, which is 375 milligrams. So I do have all the right information here. I've done my 3rd check now. First, I'm going to give him his insulin. I am going to put on a pair of gloves. And with my eyes, I'm going to inspect the skin for lesions, traumas, inflammation, or any bony prominence. The last time the patient had his insulin, he had it on the right side, so I am going to give his insulin on the left side. I'm going to grasp the skin with my non-dominant hand. I'm going to clean the area with some alcohol. Actually, I'm going to uncap this. I've cleaned the area with some alcohol. I'm going to uncap this, and I'm going to grasp the area with my non-dominant hand. And I'm going to let the patient know that I'm about to stick you so he's not surprised. And I'm going to go in a 45-degree or 90-degree angle. I'm going to push in, gently insert, squirt in, put in the medication, which is the Lantus, and pull the needle back out. I would put the safety lock on, which this one doesn't have one, and then I would put it into the sharps box. And now I take a cotton ball and just in case there's any drainage or bleeding, but I would check the injection site for any redness, any infection, or any kind of reaction to the injection. Okay, the patient, the skin looks good. Pull his gown back down. Next, I am going to remove my gloves. I'm going to perform hand hygiene. And now I'm going to give him his oral medications. So I'll give him his 2.5 of Coumadin, sip of water. I'll give him his 15 mLs of Dilantin, which is 375, and a sip of water. I'm going to assess the patient. If he was able, I might even want to check the inside of his mouth, make sure, that he actually swallowed his medication. So now that I've given his medicine, Patient has verbalized that he's swallowed. He feels good. You know, I might even go back and recheck his insulin site to make sure it's not like bleeding, which is fine. No redness, bleeding, or reaction. I'm going to lower his bed, lock his bed, raise side rails as needed, put his call light within reach, and then I would perform hand hygiene for the last time.